Heel pain treatment options. Are you suffering with heel pain? Have you tried everything and nothing seems to be working? Make sure you watch this video. I'm going to take you through your heel pain treatment options. We've got a special bonus offer at the end, and I'll share a very important patient story that you might be able to relate to and might help you get rid of your heel pain. My name's Daniel Fitzpatrick from Sydney Foot Solutions. We see over 100 cases of heel pain a week and have done for over 20 years. We are experts in this field, and we do offer a range of options, not just the traditional options like just orthotics or just changing your footwear. Not to say there's anything wrong with those, but I'll take you through a couple of options today. So you've got a great range of options so you can possibly consider these and get rid of your heel pain long term. Now, there's a couple of main options that you can consider when you do heel pain. The one that everyone's probably heard of when it comes to heel pain is orthotics. And an orthotic is basically something that looks a bit like that, and it goes inside your shoe. And there's nothing wrong with orthotics, but when you get orthotics, you've got to be willing to stay in the orthotics. They go in a lace-up shoe, and the idea is that they hold your arch in a better position and start to address the underlying cause of your heel pain or plantar fasciitis. And the downside of that is you have to stay in it. It's not corrective, it's accommodative, and it holds your foot in a better position. And that can be frustrating, particularly for females, because it doesn't fit into a wide range of footwear, and also males as well, particularly if they want to go barefoot or they want to be a bit more active in non-supportive footwear. So orthotics is very reliant on supportive footwear. It can be a very good option, but you've got to be willing to stay in it. The second is supportive footwear. And when we talk about supportive footwear, we're talking about primarily lace-up shoes with a firm heel counter, and that gives support to your foot as well. Once again, not corrective, but can be helpful. Not as helpful as an orthotic, but definitely helpful. And then the third option from a conservative management care option that you might want to consider is what we are experts in, is foot mobilization. And so foot mobilization is a hands-on technique where it works on correcting that level of alignment, and then we use exercise to support those changes. And the great thing about that is that you're not reliant on an orthotic. The downside is it takes a little bit longer to do, but the upside is it is internally corrective, and it actually helps to improve the alignment and improve the function of your foot and ankle and start to help with that underlying cause of heel pain. And it's a fantastic option. Another option that we also implement as part of our treatment strategy, whether you use orthotics or also use foot mobilization, is laser therapy. Now, laser therapy, we've got two lasers here. Laser therapy is a really cool treatment option where we're actually using a high intensity light to stimulate a healing process. The great thing is it breaks up pain, it reduces inflammatory response, and it speeds up healing. And it's a really valid treatment option because it actually goes in and stimulates that level of healing through there. It doesn't hurt or anything like that, but it speeds up healing. It helps the collagen fibers to knit. It increases blood flow. It reduces inflammatory response. And it all does it without any negative side effects, particularly associated with drugs and steroidal injections. Keep in mind that that a number of people do get cortisone injections for heel pain. The catch with cortisone injections is if you have to get them, you have to get them, and we understand that. But the reality is that cortisone isn't going to help with the underlying cause. Cortisone at the end of the day is going to mask the pain. And cortisone, the difficulty is that it actually does atrophy tissues long term. It's well documented that steroids increase your incidence or risk of tearing within tissues. So I would just be wary of that one. We understand if you have to, but cortisone is very widely used, but it does have some downsides. And keep in mind though, that at the end of the day, the reason you get heel pain or plantar fasciitis is because of the way you stand or the way you walk. And if you don't do anything about that, then you're going to have difficulty in getting rid of it long term. Keep in mind that those other options, whilst I pointed out the positives and the negatives with them, they will help with the long-term function of your foot. And the reality is that we see over 100 cases of this a week and have done for over 20 years through our clinics. In fact, we've had over 10,000 cases of plantar fasciitis and heel pain through our clinics over the years. So we are experts in the field, and that's why we make this content so that you can get some value out of this. Keep in mind that we have a 60% off heel pain assessment offer to try and help people if they are suffering with heel pain and to try and help them as much as we possibly can. Now, I want to share a story with you about a lady named Karen who came to see us about her heel pain. I want to read out what she wrote us in terms of a review, and then I'll give you some context around how we actually helped her. Karen wrote, I'd been suffering from plantar fasciitis for a long time with no improvements and numerous practitioners I had seen. It wasn't until I saw Daniel and his approach was so different to anyone else, it all of a sudden made sense. With treatment from Daniel, I'm finally getting relief and I see light at the end of the tunnel. Highly recommend. Daniel, and thank you, Karen, for leaving that review. We're grateful that you trusted us with your health and that you left a review. So thank you very much. With Karen, she did the foot mobilization therapy combined with laser therapy. And the great thing is that we were able to actually help her long-term start to address the underlying cause. She could still wear a variety of footwear. She could still walk on sand. She could still go barefoot. And we helped to break her pain really quite quickly. And she saw a dramatic improvement within 4 weeks. So if this sounds like something you might be interested in, or you're suffering with heel pain, why not check out our website at sydneyfootsolutions.com.au or northernbeachesheelpain.com.au or sydneybunyonclinic.com.au. And on those websites, we actually have a 60% off initial assessment offer where you can get 60% off a bunion assessment. You can get your, heel pain assessment. You can get your heel pain assessed for just $40. And we can come in and you can get expert advice around your heel pain, and we can help keep you out of orthotics, no need for drugs, no need for cortisone injections, and you can walk freely and get on with the things that you love.